word heart attack. They just said, you're having an event.
The leading cause of death in women is heart disease. It's greater than both respiratory disease and all cancer combined.
Why aren't we checking our hearts at 35 and 40?
1 in 4 will die of cardiovascular disease.
He told me to take some aspirin and to go home.
How poor a job have we been doing in the past decades to diagnose SCAD in these patients?
You know, I was pretty fit. I didn't present as a heart attack candidate.
When is the professionalism going to kind of kick in here?
All the early research on heart disease was done in men.
Women are underdiagnosed in mid-heart attack compared to men, and we're undertreated even when appropriately diagnosed.
Definitely breathless today. My own symptoms, the symptoms leading up to it were missed. I'm just looking to educate so that we don't miss things in the future. Because too many people are dying too young, far too young, and they just don't need to. Fight the fight. I work for Good Life for that reason, because I have a platform where I can get to people and they listen to me.
Try to do a full 15. I won't talk to you while you do 15.
Fight that fight. That's what I mean by fight that fight. At least I'm doing something. I feel like I'm doing something.
When you go down, you have to hold for the 4 count too.
Doctors, nurses, and people in general can do something too.
Still got to get WD-40 for that one. Squeak, 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 squeak.
And I was typing away and I felt kind of a cramp in my right arm, which can be pretty normal, but then it literally felt like a physical wave that I could have traced as it went up my shoulder. I was 33, but I'm going, this is weird. I've never felt anything like this.
And then I feel like I'm in a Monty Python sketch, because on the television comes the Heart and Stroke Foundation ad with a list of symptoms, barely able to point at the television. I'm like, I have all that.
And it was suddenly like, boom, I just felt like immediate like pain on my chest and intense radiating pain on my neck and my jaw and going down my arm.
Chest pain, a shortness of breath, nausea, sweating, and pain down my left arm, which even, I'm not a doctor, but even I know pain down your left arm is not a sign of indigestion. So that was my first introduction to getting misdiagnosed.
2/3 of research has historically been done on men. It's a system issue.
The Heart and Stroke Foundation released the Misunderstood Report in February of 2018. It was the first report in Canada to publicly acknowledge that our healthcare system is ill-equipped to diagnose and treat women with heart disease.
The Misunderstood Report sort of highlighted that women are under-researched, they're underdiagnosed. So I think that report was incredibly helpful in terms of really focusing on what we do know about heart disease in women and what we don't know and where our needs are.
Women have a greater proportion of atypical symptoms than men.
Sometimes they are presenting with classic symptoms, but either the patient or the healthcare practitioners have it in their mind that a 42-year-old woman couldn't possibly be having a heart attack, so this must be an anxiety attack given they have a history of anxiety.
Chain of care are the assessments and treatments performed by paramedics, nurses, and doctors. Breakdown of communication can really occur at any stage. If paramedics aren't recognizing heart disease symptoms, then women may not be receiving appropriate follow-up testing.
Women can have heart attack. Even young women can have heart attack.
While 2/3 of men will have the classic Hollywood heart attack, women will have that only 1/3 of the time clutching your chest. Women are 2/3 of the time more likely to have stomach indigestion, shortness of breath, cold sweats, or radiating pains into their jaw or their arm. It will often not be detected on traditional diagnostics. The woman then told there's nothing wrong with her or that she should seek some non-cardiac care for her symptoms.
I had gone to the doctor maybe, I'd say 5 times over the course of a month with different little symptoms, only to be sent away to take aspirin or it's a flu, or, this was diagnosed as tendinitis, actually. He told me I had tendinitis from playing baseball all those years. The first words the day I walked into that clinic were, "Please give me nitro, it's my heart." And they said, "No, we have to hook you up to a monitor to see." But I knew it was my heart because my heart started doing flip-flops and just something wasn't right. They're not sure if I had 3 small heart attacks or 1 large one when I had the open heart surgery, May 18th, 2018.
So the paramedics while they were driving down, one of them just kind of said, "I think you're having an anxiety attack."
His perception was that we should just leave it and wait a year. My husband and I knew that something was wrong, and so we pushed.
She said, "Let's just do an echocardiogram just to be sure." She said, "It can be an indication of heart disease." And she said, "I can't imagine you have heart disease, but let's just rule it out."
The week before my heart attack happened, I had been through fairly rigorous medical testing to prepare myself for a knee replacement surgery. And I had passed all of the exams with flying colors.
After he left, a nurse from Emerge came in to talk to me, and she said, she told me very sternly, "You'll have to stop asking questions of the doctor. He is a very good doctor, and he does not like to be questioned." When my symptoms returned, which of course they did, there was no way I was going back to emergency and make another fuss over nothing.
The major arteries of the heart are on the outside of the heart. So if this is the heart muscle, these would be the arteries that are sitting on the heart and providing blood flow through smaller branches that penetrate into the heart muscle. These would be the microvessels of the heart.
Microvascular disease is 3 times more common in women than males, and that women who have microvascular disease have much higher risk of suffering a heart attack or even a death as a result of heart disease.
We first became aware of this in 1984 when we saw more women dying every year of cardiovascular disease. Physicians are increasingly starting to recognize this. It's a bit of the Me Too in medicine.
Blood work measures a protein called troponin that's released into the bloodstream when heart tissue dies. The problem is, the reference range of what's considered normal is based on a male heart, not a female heart, which is smaller than a man's heart. So a woman can be having a heart attack, but her blood results will come back normal.
As we learn more and more and more about women, we recognize that that model's different. In the early years, we sort of just said, well, that's an atypical presentation. I think we now have a critical mass of data to suggest it's not atypical, it's typical for women. We absolutely need to clear up the language and say there's typical male presentations, there's typical female presentations. There's absolutely overlap between those 2 things, but there are things that are going to be unique to the male experience and unique to the female experience.
Perhaps the use of the term atypical is not appropriate and will change in the forthcoming years.
You know, we're socialized to take care of other people, to put other people's needs ahead of our own.
If a man or a child is sick, they get to be sick. Women don't.
We put things off, you know, because the kid's got to get here, or we've got this function to do, or we've got this, you know, we have got to get the house clean, or we're at our job and there's deadlines to meet, and we're not paying attention to ourselves when our body is yelling at us.
He's my world. He's the apple of my eye. He's probably the biggest driving force of why I have done what I've done and do what I do. Next to the heart disease, you know, trying to fight for my life to be longer so I can be here for him. Oh boy, she was a big presence. She was loud, she was proud, she loved glamour, she loved diamonds. Everybody loved Barb. She could be a hard ass. She could be hard and stubborn, but she had the softest heart you could ever come across. Barbara actually texted me. It was 2 o'clock in the morning one night, my sister Barbara, and she said, her exact words were, "Heather, am I going to die? I'm scared, please tell me the truth." Well, I didn't reply. I got up, I got dressed, and I flew across the street here to the hospital. And I said these exact words to her. I said, it's hard for me, sorry. I said, "You're not gonna get any better, Barb. We know this." I said, "I don't know if you have 3 weeks, 6 weeks, 6 months. Nobody knows." I said, "But I do know that we fight the fight, and we fight the fight to the bitter end, and we leave with love and hope in our heart." And I have a picture of her and I pumping fists in the hospital bed. And I've got it in black and white up in my office at work. And I look at that every time I'm struggling and think I can't get through something. I look at that picture. And in my head, I'm going, fight the fight. No, she was a good person. She really was. And it was sad to see her go through this. It was sad to see the vibrant, strong, hard-ass woman turned into somebody who couldn't even do up her housecoat.
I had 3 arteries that were plugged. One was 100%, one was 80 and 90 in a strand, and the widowmaker, which is your main artery, was 70%.
And then they brought pictures of the scans to me and demonstrated that I had 5 major blockages, like over 90% blockages.
You have a weak heart. In layman's terms, your pump is really weak. And you need to get to a cardiologist. And they said it quite quickly.
The second time I went back to Emerge, I could tell right away, just by the looks on everyone's faces, that something was very different than it was the first time, 2 weeks earlier. This time, for example, they called in a cardiologist. He said, Mrs. Thomas, I can tell from looking at your diagnostic tests that you have significant heart disease.
SCAD itself is caused when the interior wall of the artery tears, and instead of the blood going in between that tissue, it goes in between the tear and the outer of the wall, so it creates a blockage and you have a heart attack.
The last heart attack I had in 2017 was that I had 3 arteries dissected at that particular time, and according to them, that is considered a very rare event.
They used to think that SCAD was extremely rare, but what they're discovering now is that it's underdiagnosed.
50 years of clinical and scientific research on heart disease has been largely with a male model.
We are beginning to understand the other causes of heart attacks in women that are highly relevant to women.
Up to 50% of women presenting with chest pain do not have blockages in the major blood vessels feeding their heart muscle. But 50% of women do have evidence of abnormal microvascular disease.
The traditional cardiovascular risk factors include type 2 diabetes or type 1 diabetes, high blood pressure, high cholesterol, smoking, and having a family history of heart disease or stroke.
And then there are sex-specific risk factors, particularly for women related to reproduction. Hypertension during a pregnancy, preeclampsia, a baby that's too large or too small, and then finally diabetes that's brought on by the pregnancy.
There are so many other risk factors that affect women that go beyond pregnancy-related risk factors. But unfortunately, many healthcare professionals still don't know what they are.
And if we're not bringing up some of these major issues in women's heart health at these various CMEs and conferences and whatnot, it doesn't get brought up again. And if it's not in their mind to go look it up specifically, they may not be even aware of microvascular disease or dissection of an artery called SCAD or a vasospasm of an artery.
We know that women that treat women in the emergency room are more likely to recognize heart disease and treat it more effectively.
Once we actually do these tests, and we do find that, yes, they've had a heart attack, the ECG is abnormal, a lot of times women are actually treated differently.
After a heart attack, women tend to not have the same type of investigations that a man might have. Similarly, they're not sent home on the same medications, the same life-saving medications that we know prevent another heart attack.
Recently, I was just at the American Heart Association meeting, and I listened to a panel of experts talking about models that could be used to study heart disease. And at the end of the session, I got up and asked a question. My question was, I heard nothing about sex representation in these models. And these were, esteemed colleagues and experts in the field. And so I think I was struck. I thought we were making progress, but I'm not sure that we are.
Yeah. I don't know if you can see that. My sister Lorna, I believe, was misdiagnosed. She was in the hospital the night before she died with a heart rate over 200. Nobody's heart rate is over 200 for no reason. There's a reason for that, and it wasn't going down, and they never kept her in. My sister Ann Miller passed away in 2011 of end-stage heart disease. It was just a horrible thing to watch. I can't even describe it to you properly. She was in heart failure, and it was just a slow process from then on. My sister Sheila died in between Anne and Barbara. She was 61. The heart was just too weak for any kind of treatments at all. A month after my surgery, my brother Gordon passed away, massive heart attack, blood clot to the heart. So that's 5 of them gone. There's only 3 left, and all 3 of us have heart disease. And all 3 of us hang on to every day, like, you know, we're checking with each other, making sure, are you okay? How you feeling today? We live in fear, right? My son lives in constant fear that his mom's he's gonna wake up and not have a mother tomorrow.
I made sure that I had power of attorney in place, that I had personal directive in place. I wrote a letter to my husband, to my son, and to my in-laws, telling them how special they were and to thank them for being there.
And I mean, I'm having heart attacks. Like, I don't want to die.
I went directly from the ER to the OR, essentially. And I had a stent implanted in what doctors still call the widowmaker.
My heart rate got up to 255 beats a minute. And then I got shocked, and then here I am. And so I asked my cardiologist, I said, so what would have happened if I didn't have that? He said, hopefully somebody would have started CPR on you. He said, but you wouldn't have come out of that on your own.
Hello?
Hi, Heather. It's Marion calling from Dr. Judy's office. How is your breathing? Are you still feeling short of breath?
Just one sec, Marion, please. Actually, this is good. This is my doctor calling me with my results. Hi, Marion. Sorry. Actually, the day before I went for the second blood test, I took it upon myself to take a Lasix, and that helped. So my breathing's a little better. Is it still showing I'm in heart failure?
Well, it is.
Somewhat better, but I still struggle for breath a little bit here and there. Like if I talk a lot or come up the stairs. No, never. The first 2 heart attacks, I was on it for 6 weeks, and that was it. I've never been on Plavix since. Okay, Marion. Okay, thanks. Bye-bye. So I'm in severe heart failure, which is not good, but just treat it with meds and just keep doing what I do, right? There's just no other option. Just got to keep doing what I do. I don't know what's causing it, because I feel good for the most part. I haven't felt, my strength has not been there since the surgery. So it definitely takes a toll on you. You know, and when I do this, it just, like I said, it validates what's happened to my family, and it just keeps me going. Because I truly, from the bottom of my heart, I don't want anybody to go through this. It's too much. Sorry. Okay, enough of that. Bite the bullet, Heather.
Wouldn't it be lovely if before every person leaving the hospital on discharge would be told, this is something that's very common, post-cardiac depression, what they call situational depression. A situation has happened that is so traumatic for the human brain and the human body that you need some help getting through this. It's common, it's treatable, and it's usually temporary.
And all it takes is for someone to look at me and like, so what's going on with you? And I'm just like, and I just start crying like, oh my gosh, that's, you know, even if I would have an emotional moment, I could take a breath and suck it up. And I've learned the hard way that I can't really do that anymore.
I wasn't advised that this was going to be something I needed to deal with mentally. And I always say this to people, everybody else's life went back to normal, right? Once the shock for my family and people that I work with, once that kind of died down, it was like everybody else's life went back to normal except me. This was like forever now.
You'll read the stats once you start getting progressive heart failure. There's a 5-year lifespan. All right, so I got a lot to do in 5 years. Puts added pressure on you, and you don't want to live thinking that way, but it's always going to be here. right? But you're not going to let it affect your daily life or how you roll with people. Or I have to accept it and make the best of the moments that I have here with the people that I love and that love me, because it breaks my heart to think of the day that I can't be there.
I will be a little bit much more aggressive next time.
I think it's critical that we have all levels of healthcare providers and scientists and policymakers involved.
Fewer lives would be lost if we had sex-specific protocols.
At 40, you start getting mammograms. You should also go in and get an echocardiogram.
There's so much work that needs to be done.
What you feel is real and important, and you should never feel afraid about communicating that.
State, I think I'm having a heart attack. It's going to open up the system to appropriate diagnostics and interventions.
So the minute you feel it, go to a clinic, go to a doctor, go to a hospital, and get it checked.
I had to listen to my gut and my heart.
Trust in what your body is telling you.
And then do exactly what you would do if it were your daughter, or your mom, or your sister, or your friend.
You need to be as smart as your doctor.
You know when something is just not right.
Fight the fight, validate the rest of my family's death. That's how I want to spend the rest of my life. Dedicated to making sure that people don't get it, or if they do have it, they prolong their life.